So we're going to start with Anfa up the back. I tend to always start with Anfa. So you just get the animal used to your touch. You can have a little feel. So you'd be looking for any of that twitching discussed earlier. Yep. She really hasn't got any, which is good.
I've noticed that. I found that really odd that she doesn't have any twitching. I'm like,
it's not too. I mean, it's not too tight.
I found it really like, you know, most dogs that
Yeah,
I've
have
touched
some.
the back
Yeah.
of, I see some twitching.
Cleo twitches. Yeah, Cleo.
But there wasn't a lot I saw on her,
It's good though.
which just surprised me. I was like,
Yeah,
you know.
No, there's not too much. I'm using pretty good pressure.
Yeah.
So I would go up and down over maybe 3 minutes, just having a look and using good pressure, just getting used to it. And then I'm going to do some focused point work. Going to start at bladder 17. So I'm going by the lower border of the scapula, finding T5. Cool. And I'm just going down to T6, T7. So this is blood point. So I'm just going to do unwolfa there, either side of the spine. So about one chewing out from the spine. So this helps with blood. Often, that was not measured. Often with skin conditions, especially in dogs, there'll be underlying blood deficiency. Really common. And it's normally like diet related. And yeah. So you think, you know, protein, having
Digestion and stuff. Or like the microbiome.
Microbiome is another one. Yeah. So I'll be sitting on there for maybe 2 minutes. And then working down to T10, so 7, 8, 9, 10, and T10 is the liver, so bladder 18. And the liver is closely related to skin issues, a number of reasons. I mean, the liver is responsible for moving the chi, the blood.
And purifying blood.
Yeah, that's another thing. In Chinese medicine, there's not too much of an emphasis on that, just because that's kind of more of a Western concept.
Yeah.
But it's the liver. So, for example, when the liver is blood deficient in Chinese medicine, it gives rise to what we call wind.
Okay.
And wind, again, it's just metaphorical. It's, again, the Chinese described conditions by what they saw. And wind basically is like itching in the skin. Okay. Yeah. It can also be other things like stroke. In Chinese medicine is often wind. Okay. And it's more just the symptoms that come from it. You know, fogginess, sometimes like involuntary kind of loss of muscle tone. So, yeah, just as a kind of brief description, we always treat the liver. Yeah. And, if there's itching, we often describe that as being a wind condition. It can be other things, but more commonly it's wind. So we're around there. She likes it. And then we're going one down to gallbladder. Gallbladder and liver closely related, closely interlinked. Western medicine also has that reference. Chinese medicine is the same. So that's T11.
She's like that.
She's loving it. So I'm doing unrolfa. I'm using quite a bit of pressure. She's actually pushing into me. Yeah.
Like I find her lower, I know you're not quite the lower back yet, but her lower back, she does push into the pressure a lot.
She really wants it, which is good. So again, you could be working around there for 5 minutes. We're doing quite a lot of work.
So need to watch this one back and the arthritis one and just do those on her every day.
Yeah. Definitely.
I have noticed since you did that little you used her for the demo for the IBDD and the arthritis. It's like she's been wanting more touch.
It's great. And she knows.
Do you get what I mean? Like it's kind of like she's like, oh, that actually, you know, I don't know. Like she's kind of been, not that she's not affectionate, but you know, she's not cuddly or you know. But I've just noticed it's like she's asking for more touch.
It's great. Yeah, they're intelligent animals. I think are just so sincere. With their healing, but they just want to be better. When humans, it's so much more complex, often emotion and emotional association with illness and so many other things. When animals are just now we're doing Nifa. Sorry, and I'm doing it up the spine, but also the governing vessel. So the governing vessel is a channel that runs up the spine.
So on the spine,
correct? Yep. We have gone over one of the two. So we've done 14, which was at C7, and then governing vessel 20, which is
Oh,
on
yeah.
top of the head. And then we did do the one
Oh,
over the
yeah.
nose. Yep.
Yeah.
26. Yeah.
Yeah.
Cool. So I'm going up there. And the reason I'm doing that is it clears heat.
Okay.
So with skin conditions, there's often inflammation. Well, undoubtedly inflammation.
Sorry.
That's fine.
Got a bit of an itch.
So clearing that. I can actually carry it. So I'd spend.
So you're just going from the top of the sacrum right to the...
Yep, base of the neck if you
Yep.
can. Yep.
Yep.
Yep. Caudal to cranial.
Yep.
Yep. Yep. Go. Yeah. Say 12 times even. Yeah. And then I'm going to do some paiwha. And again, I'm trying to clear heat. Doing it up the governing vessel as well. I'm breaking the rule of only doing it at the end.
Oh.
But there's always exceptions, right? Cool. It's been a couple minutes, so you don't need to do that too long. Then I'm going to do some Yeezy from gallbladder 20. So behind the base of the ear.
Trying to remove her collar.
That's fine. This is one of the wind points. So good for itching skin, acute skin conditions. And then I'm going to go to do 14, which is at C7, base of the neck. Good for clearing heat, so inflammation. So I'm going to go easy down. I might bring the collar down a little bit. And ideally doing both sides. I do encourage you to practice both hands. My right's a lot better than my left because I didn't make myself do both, but that's okay. She's a very good demo dog. So again, you could do this for a few minutes. So you're already, maybe 10, 15 minutes into your massage. Then I'm going to do some chofa on the forearms.
Thank you.
Oh, she's very good. Okay, you sit there. And again, just clearing heat, invigorating all the channels along the forearm. And if practical, trying to do both sides, but if not, that's okay too. Cool.
She's got better technique. You look more relaxed with her doing it than I was trying.
That's the warm up. Then we're doing some Nianfa. So that was the down on the toes. And again, this is clearing the channel. So good for heat conditions.
You just kind of gently rub them.
Yeah.
It's got the touch.
Shalling's had a lot of practice. And then going through all of them.
Would you do the back legs?
I'm just doing the front legs for this treatment.
Yeah.
But you're welcome to if you want to. Yeah. You can, That's the joy of TuiNa, what I do. You might want to do something different and that's totally fine too. Yep. You get creative initiative. So you go through each, say twice, of the Nianfa on the toes. And then I'm going to do some taiwha from large intestine 11 to 10 and then down to 4. So 11 is at the elbow there. Remember 11?
Yes.
Yeah. Midway between there. This point's good for clearing heat. So it's really good for inflammation. For any skin condition, I would always use this point. And then 10 is 2 chin down from there. And then we've got 4. I don't know if you guys remember that down between the first and the second.
Yeah.
On the side there. Where my index finger is, not my thumb, sorry. I'm just bracing my paw. Cool. And that's again good for clearing heat, good for skin conditions, good for the face. So I'm going to do taiwha down there. And then going to try and go around there. If I had her in a better position, it might be a bit easier for me. But I'm also aware of not overextending her arm. So you're clearing the channel as well. So you could go down there, say 6 to 8 times, covering those points. Cool. Both sides. Once you've covered that off, I'm going to do TuiNa from lung 5 to 7 to 9. So 5 because it's a good point for skin conditions specifically. As well, 7 is good for the immune system, and 9 as well is good for the immune system. So skin conditions, you will have immune system involvement there. Cool. See, maybe this one might be actually a little bit easier if she's.
And would you normally do it on both legs, or you just one leg's fine?
I mean, if you can only
Depends on the
practically, like how she is, I wouldn't want to, she's so relaxed, I wouldn't want to blow that by rolling her over or anything like that. So I would keep her...
Ideally both, but
if not possible, that's okay too.
Yeah, cool.
Yeah, what you can get to...
If they can enjoy it, that's...
Yeah. This is it. That's more important than...
Pushing it.
Never blow it.
Yeah.
So I'm going from lung 5. So that's on the...
In the crease?
Yeah, it's in the elbow crease.
Yeah.
Mm-hmm. We did cover it. It's...
Yeah.
Do you remember?
I can't remember something being in there.
Yeah, okay.
I don't remember it was lung 5, but I do remember there being a point in there.
I can show you in the book here. So you can have a little visual too. It's a good one to know. Cool. So clears lung heat phlegm. So, yep, cool. It's good for respiratory problems as well. So it's in the elbow fold there, medial fold, between the brachial muscle and the biceps tendon. Just so you can see the visual there. Mm-hmm. Cool. Mm-hmm. Nice. And then we're going to go down to 7 and then to 9. Okay. Nice. I might start with this. Good girl. It's actually quite easy with this leg, how she has it. To just stretch the channel. So 7 is on the silent process and 9 is at the transverse wrist crease. And again, I'll go down here 6 to 8 times. That's actually quite easy in this position, me leaning over here saying use my body weight. Both sides if you can. Cool. Once you've finished that, I'm going to go to the hind legs and I'm just going to do some points to support her digestion. I'm going to do spleen 9. Cool. Use it to be fair. So medial side of the condyles of the tibia. Or it might be easier just to show in here. So in here.
Oh, yeah.
Yep. In here. And it's good for what we term in Chinese medicine damp. So any conditions that are, the fluids are not moving, congealing. Yeah, damps are good. But it's a good digestive point anyway. Yeah. So I'm going to do spleen 9 and stomach 36 at the same time. So spleen 9 being here and stomach 36 is just lateral to the tibial tuberosity, the ridge there, just out. So I'm using my thumb on spleen 9 and my index on stomach 36. Stomach 36 is good for the immune system. It's good for digestion. It's like it's an amazing point. It's good for so many things. Yeah, I would incorporate it in every treatment just to support the digestive system.
It's such an important point. Don't have good digestion then.
It's integral for everything. Yeah. Cool. And you could spend a few minutes there, both sides.
Yep.
If you're getting short of time, you could make it more efficient. And I'm going to actually wrap this treatment up by doing Gwenfire down the spleen channel. So the spleen channel is going down the inner leg. Cool. And the spleen channel comes across. So I'm just going to go down the thigh because I'm not going to do Gwenfire on her foot. So this is just nourishing. She's quite comfortable with that. And doing both sides. Turn a couple of minutes in there, and actually while we're here I can get to stomach channel too. I'm going to do it down there just as an add-on. So I'll be doing spleen, stomach, and then I'll just be leaving it at that and then I'll relax.
Oh.
How does that feel? Right?
Yeah.
That was good.
There we go, Inky.
How are you feeling, Inka?
There was moments of that you were looking like you were about to fall asleep.
She's like, oh,